Professor Zamorano, why you decided to produce this cardio-oncology position paper?
Well, there is no doubt that oncology is a social problem, and we have developed treatments to better treat our oncology, our cancer patients. But nowadays, the patients, they do not die or they survive much more from cancer, but then they have problems with the heart. So we treat the cancer, but those drugs may damage the heart, and the patients may develop heart failure, arrhythmias, hypertension, and therefore we need to work in a multidisciplinary team, cardiologists with the oncologist, for the best for our patients.
There are already hospitals in which these teams have been built up, or it's only an idea, a good idea, but an idea?
No, there are already some hospitals that they have cardio-oncology teams. So it's really multidisciplinary, and they are working together, and they are treating the patients together.
When the toxicity of this oncology drug happens, it's immediately, it's after many years, when?
Well, this is really relevant, this question, because the toxicity of the drugs may happen immediately after, but also it may happen that the patient is treated with some drugs, and then after is relieved from the cancer, so he's now healthy, but maybe 8 or 9 years after the patient has received the treatment, then suffers from heart problems.
Which are the most important cardiac damages caused by these oncology products? Could you provide us some examples?
Sure. I think there are 3 main issues there. First and the most important is heart failure. So we may damage the cardiac function, and we need to monitor and we need to follow the cardiac function of the patients. Second, the patient may develop arrhythmias, so we need to be sure that the ECG is normal, that there are no arrhythmias, and also it may happen hypertension. So we need to control the cardiovascular risk factors in these patients.
Also, radiotherapy is involved in these heart damages.
Absolutely. We have involved radiotherapy because it may develop coronary artery disease. We have problems in hematological problems. The hematologist should be there. So it's really a multidisciplinary team.